Dr. Salvador Plasencia stood in federal court on Wednesday, his expression grim as he formally pleaded guilty to charges that have shaken the medical and entertainment communities alike. These charges stem from his role in supplying ketamine to actor Matthew Perry, whose tragic death in October 2023 was ultimately ruled an accident, but whose addiction struggles had spiraled into a fatal chapter. Plasencia had already agreed last month to plead guilty to 4 federal counts of distributing ketamine, a powerful anesthetic also used in mental health treatments, but one that, in the wrong hands, can be deadly. At Wednesday's hearing, the court confirmed that he would remain out on bond until his sentencing, now scheduled for December 3. But no matter the delay, the gravity of his plea sent shockwaves across the courtroom. In the eyes of the law, Plasencia now faces up to 40 years in prison. He also faces 3 years of supervised release and a potential fine of at least $2 million. But perhaps just as significant, he has agreed to surrender his medical license, a symbolic and sobering acknowledgement of his failure to uphold the Hippocratic Oath. Dr. Plasencia is profoundly remorseful, said his attorneys in a statement. He acknowledges his failure to protect Mr. Perry, a patient who was especially vulnerable due to addiction. That failure, according to investigators, went far beyond poor judgment. It crossed into a dangerous pattern of behavior that contributed directly to Perry's untimely death. Matthew Perry, beloved for his role as Chandler Bing on the hit show Friends, was found unresponsive at his home in Pacific Palisades on October 28, 2023. The Los Angeles Medical Examiner's Office later determined the cause of death to be acute ketamine toxicity. At the time, Perry had been undergoing medically supervised ketamine therapy to treat long-standing issues with anxiety and depression. But investigators discovered that his legal treatments had been supplemented, and eventually overshadowed, by illegal purchases made outside official medical settings. One of the central figures in this operation was Plasencia. But he was not alone. Kenneth Iwamasa, Perry's personal assistant, also entered a guilty plea earlier this year. In his testimony and plea agreement, Iwamasa painted a chilling picture of a man in the grips of addiction, and of those around him enabling that addiction for profit. According to court documents, Iwamasa met Plasencia just weeks before Perry's death. During that time, the doctor provided both liquid ketamine and ketamine lozenges to the actor, powerful dosages far beyond clinical recommendations. Incredibly, Plasencia also taught Iwamasa how to inject Perry with the drug, despite the fact that Iwamasa had no medical training. It was reckless, it was dangerous, and ultimately, it was fatal. In the month leading up to Perry's death, the actor reportedly paid Plasencia upwards of $55,000 for the drugs. Federal prosecutors allege that Plasencia knew exactly what he was doing. In fact, they argue that he knew exactly how sick Perry was, and how far gone his addiction had taken him. One patient told investigators that Plasencia had described Perry as too far gone and spiraling, but still chose to provide the drugs. In a series of text messages unearthed during the investigation, Plasencia and another doctor, Mark Chavez, who also pled guilty, were caught joking about how much money they could make off of Perry. The tone of those messages was callous, even cruel. 2 licensed professionals, laughing at the vulnerability of a man who trusted them, and who would not live to see the fallout of that betrayal. The case has reignited conversations about the dangers of poorly regulated ketamine treatments, a therapy that has shown promise for many patients but also carries serious risks. In Perry's case, the line between therapy and abuse was not just blurred, it was obliterated. His death, though ruled an accident, has left behind a trail of complicity, greed, and profound medical misconduct. The public now sees a clearer picture of the final weeks of Perry's life, of a man trying to manage his mental health but pulled into a vortex of exploitation. He was not just a Hollywood star. He was a patient, a person, and, as his loved ones would say, someone who deserved better. The legal consequences for Plasencia will be decided later this year. But no matter the sentence, the damage is already done. Matthew Perry's death, already a tragedy, has now become a cautionary tale, a stark warning about what happens when those sworn to heal choose profit over protection. The case has also drawn scrutiny on celebrity healthcare, where access to resources sometimes comes with access to enablers. And in this case, that access proved fatal. As the December sentencing approaches, the question will no longer be about guilt. That part is settled. Now, it will be about accountability. How do we ensure that those who exploit the vulnerable face consequences? How do we ensure that medicine remains a profession of healing, not hustle? And most of all, How do we honor the memory of someone who made millions laugh, while privately fighting a war he could not win? These are questions the court may never fully answer. But the people watching, fans, families, and future patients, deserve to keep asking.